Joined in the studio by Dr. Boules Gabriel, Clinical Director, Oncology, African Medical Center of Excellence, and virtually I have Dr. Chinedu Aruah, Oncologist at the National Hospital Abuja. Thank you for joining us, gentlemen.
Thank you so much.
Thank you. Thank you.
Let me start off with Chinedu, who's at National Hospital and joins us virtually. Chinedu, well, when we were reading, before we heard that report from my colleague Emmanuel, we're talking about the fact that most times in Africa, cancer is discovered at a very late stage. And what would you say is the reason behind this? Tradition or ignorance?
Well, it's multifactorial because culture plays a major role, and the wealth of knowledge of the patient equally is contributory. And then we look at environmental factors, socio-cultural, socio-economic milieu in which the patient finds himself, and availability of the experts, and health-seeking behavior of the individual. So there is a multifactorial factors that cause why patients present very late, and that late presentation is one of the major causes why we do not have a cure. Normally, patients present at a point where we are talking of palliative instead of curative intent.
Okay, so Boules, we now have specialist hospitals across the country, and yours is one of those as seeking center of excellence, so to speak. But yet, what Chinedu has talked about, that culture, traditions, and then sometimes ignorance also plays a role. So you have some of these cases coming in so at a very late stage. What do you do?
Yeah, thank you for this question. I think I agree with my colleague, but I have a different point of view. What makes anyone comes late is fear, stigma. For females with breast cancer, she fears we are going to cut her breast out. For males with prostate cancer, he may think he is going to lose his potency.
Yeah, you know what Chinedu said was, he said multifactorial.
Yeah.
I was the one that just focused on the culture, and but you added the one called fear. So culture, tradition, fear, ignorance.
Yeah.
Okay.
So how come we should move now? So we need to turn into action. And your program and this time now is one of these actions. We need to raise awareness for those who ever going to be afflicted with this disease. Early detection saves life. Early detection saves life, number one. Number two, you have too many good people in the country in terms of experts, in terms of diagnostics, in terms of everything. So please, it's a call for action. Whatever you have, go early to check with your physician, or check yourself once at least per year for common cancers.
But Chinedu, back to you here. The question then will be, what are those things that might lead up to a cancerous situation? Are there any causative factors that one can easily lay hands on that are avoidable? Or, and Boules talked about check yourself. Do I need to go to the hospital to check myself? We do know that for breast cancer, you feel for a lump and all of that. But what else? There might be other cancers. How do we even begin?
Okay, there's a lot of, let me put it again, multifactorial risk factors that may lead to cancer. So it depends on the cancer you are discussing. Are you discussing breast cancer or prostate or colorectal cancer or head and neck cancer or whatever you call it, blood cancers, maybe non-Hodgkin's lymphoma or lymphomas. So it depends on the cancer you are discussing about. So, but in overall, we look at those that are preventable. The one that by activities of a man, you can prevent them. And there are some that are hereditary, in which there's a genetic factor, which is about 5 to 15% are genetic. The others are sporadic. So that sporadic factors is that there's nothing much you can do, but you can do some life-modifying take some life-modifying actions that can be a little bit preventive. So the bottom line is just going for screening tests and early detection, just as my colleague said, which will help you to strengthen the diagnosis and also ensure early intervention. Okay. Because early intervention is the key to curing cancer.
Early intervention, early detection, Okay, early detection,
Yeah.
early intervention. Boules,
Yeah.
is there anything, when it is even discovered that cancer is there, precision treatment, do we have that available in Africa?
Yeah. So the good news, we have it. And let's see first what is precision is. We need to increase the probability of curing the cancer and reducing the probability of side effects, right? We will be successful to do so if we discover the disease early. Luckily, we have, where I'm practicing now, the precision oncology techniques, the cutting edge technology, the expertise in place. So we have access, I think, yes, we have.
But does that cut across Africa? We have in the National Hospital, what do we do? Because right now the theme for this year is replacing fear with hope, right?
Yeah.
How do we take out fear and bring in hope for everyone? And this goes for the two of you. You have 30 seconds to answer this. What do we do to ensure fear is knocked out and hope is brought out for everyone? Since I started with Chinedu, let me start with you because I'll end with Chinedu.
Yeah, I like this question so much. So currently, I have been here in the country for the last 15 months. I started to build a lot of good networks and a lot of friends from everywhere. National Hospital is a serious hospital. It's a huge hospital in the country. And now we have this friendship collaboration of, if I do not have the technique, I refer to you. If you do not have the technique, refer to me. So what we have now is like multidisciplinary discussion for the sake of assure the patient. We are trying to impact patient's life, trying to reduce fear and increase hope.
Chinedu?
What I want to say is that we need to up our game in terms of cancer awareness campaign, and also to let people know that diagnosis of cancer does not mean death sentence. And most of the campaign have been a township affair. It's high time we translated this campaign in various languages and get it down into the villages and towns, all the nook and cranny of the country, and that will help, especially using those who are equally the experts who are in the field, and also you people who are in the media, spreading the news that we have the available equipment, we have the available experts that can help you take care of this disease when it is detected early and early intervention is instituted. So that will help us to knock off the fear, because, and also the amount of information that the patients get is equally very helpful, and improving their health-seeking behavior through this media, social media, through radio jingle, through TV, through every source of media information. Equally help.
Thank you so much, Chinedu. Thank you, Boules. And just before I let you guys go, let me add in my own. I know Chinedu mentioned something about lifestyle change. Get active, exercise, eat well, sleep well, rest, and check yourself, know yourself, but also talk to a medical person. No matter what, don't worry. There's hope everywhere. I mean, as they said, the technology is on ground, but it starts with you, right? That's what you do.
So much.
Okay, thank you so much. We've been speaking with Boules Gabriel, Clinical Director, Oncology, African Medical Center of Excellence. And virtually we had Dr. Chinedu Aruah, Oncologist, National Hospital Abuja. Thank you, gentlemen, for coming in this evening.